Good day, everyone, and thank you for joining us for today's e-seminar on a new dimension in anti-aging treatments with Dr. Matteo Tretti-Clementoni. Before we begin, let us cover a few items of note that will enhance your experience. First, the system only allows the presenters to talk. This is to keep background noise out of the discussion tonight. Second, we welcome and encourage you to ask your questions. Please type them into the comments box located on the GoToMeeting control panel. We will cover all of them at the end of the presentation. This will keep the presenter from covering the same piece of information twice. With that covered, sit back, relax, and enjoy today's presentation. We are delighted to have as our presenter Dr. Matteo Tretti-Clementoni. He's a plastic surgeon and laser surgeon at the Skin House in Milan, Italy. He's a founding member of Dermatologic and Aesthetic Surgery International League and Cosmetica. He's a member of numerous scientific societies, author of 192 publications, and an invited speaker at 109 congresses. And he's laser professor at the Master of Aesthetic Dermatology and Aesthetic Laser Surgery School. With that introduction out of the way, let me hand the presentation over to you now, Dr. Clementoni.
Hello, everybody. I'm Matteo Tretti-Clementoni. I'm a plastic surgeon, and I'm living and working in Milan, the north part of Italy. It really is a good morning to the people who are living in the west part of the world, and good night to the people who are living in the east part of the world, and good dinner for who are living in the Europe. Today, I would like to share with you my 15 months experience with the fantastic device is the microneedling device called Infini, produced by Lutronic company. In July 2013, I did an interview to the Prime Journal, and I said to them that the only big development, the only big news that I saw in the recent year has been the microneedling radio frequency. In fact, at that time, I was thinking that this device could help me to solve two big issues I had. The first one was to treat the skin laxity of the neck, and being a surgeon at that time, the only tool I had in my hands was surgery, but I really needed something else. And the second thing that affects a lot Italy is to treat tanned people. Here a lot of people start to do long weekend and go to the sun very early during the year, so starting maybe in May or at the end of April. And this means that for June, July, you have a lot of tanned people. And on tanned people, I'm really worried to treat them with laser for the risk of PIH. What I understood at the beginning of my experience with this device is a very simple thing that I always explain to my patients every day. And this is the difference between this device and all other lasers. We can consider that lasers are devices that works outside in, while the microneedling radio frequency is the device that is working inside out. So the big difference is that if you want to transmit energy with laser, we have to pass through the superficial barrier, while with the microneedling radio frequency, we can pass over that with needles, and so we can deliver the energy exactly at the depth we want. Speaking about radio frequency or the current radio frequency technology, we can divide it in two big families. The big one is the surface radiofrequency devices. They deliver a great amount of energy to the surface and much more than deep, and require active cooling. They usually heat and don't generate dermocoagulative damage, and sometimes they have limited depth and increase the downtime and the PIH risks. These big family is composed mostly by two major categories: the monopolar radiofrequency and the bipolar radiofrequency. The monopolar radiofrequency pushes energy deeper with less predictable heating patterns. Bipolar could be more predictable, but is still not exact and not fractional. They don't create a coagulative heat effect, and this is the most important. The prediction of the treatment is not so easy to do, because the transmission of energy depends on skin quality, on skin hydration, on skin thickness, and naturally it depends on the amount of collagen of the skin. So it's very difficult to predict the results you can obtain. But as usual, before starting a new thing, I went deeper inside the papers published in the literature, and this is what I found. David Goldberg published in 2012 a fantastic review on the radiofrequency, and if you go deeper inside this paper, you can see that, speaking about the monopolar radiofrequency, the major limitation to monopolar radiofrequency devices are the associated pain and the modest effects observed. And so there's a big limit, in my opinion, about the results and about the pain the patient can feel. And if you go again on reading the same paper, when the paper speaks about the bipolar radiofrequency, we can see that the major limitation of the bipolar radiofrequency devices seems to be the depth of penetration. And maybe adding some light devices, some light sources, we can do over this limitation. But if you take the bipolar radiofrequency alone, the major limitation is probably exactly the depth of penetration. So the other big family of the radiofrequency technology now present on the market are the needling devices. The first generation used manual insertions of the needle. The needles are very thick, and so it's very difficult to insert them, and they are very and the procedure is very painful. And there are other devices that don't present insulated needles, and not insulated radiofrequency needle deliver energy over the entire length of the needle, and this can cause a superficial injury and can increase the downtime and naturally the risk of post-inflammatory hyperpigmentation. So today I will share with you my experience with this device, that is a microneedling radiofrequency with insulated needles. And at the beginning I will describe you the technology, and I will conclude with my experience and the experience of other colleagues around the world that have fantastic results using this device. This is the handpiece, and on your right you can see the device. It's very easy to use, and if we go here in the center of the slide, you can appreciate the device again. We have an ergonomically designed handpiece. It's not heavy, it's very light to use, and if you use it all the day, this is a very important thing. The color touch screen is very easy to use. You can set the level of energy, the pulse duration, and you can decide to use that with your fingers or with the foot switch. And so these are the two ways you can deliver the energy. The body of the device is a slim, sleek body, and is a very high power radiofrequency, reach up to 50 watts. The secret of this device is not the radiofrequency, as you can probably understand, but is somewhere else. It presents an array insertion if 100 milliseconds is automated to a controlled preset depth. The depth of penetration is adjustable from 0.5 to 3.5 millimeters, and the needle you insert presents a 20 micron short tips with 300 micron active tip of a needle of 34 gauge. And these disposable tips are very cheap and not absolutely very expensive. We have a 7x7 array of insulated microneedles. As I told you before, is 200 microns in diameter, is around 34 gauge needle, and they are completely insulated except the tip for 300 microns where there is the active electrode. And this is very important because the energy is delivered only at the tip of the needle, and it can preserve the surface. The bipolar radiofrequency generates precise electrothermal damage at the preset depths inside the dermis. And this means also that we have no thermal damage at the very critical layer, so and at the dermal-epidermal junction. This is the way how the device is working. As you can see, there are 7x7 array of needle, some with a plus and some with a minus, and the energy is going from one to another, and this creates inside the dermis the damage zone. And this damage zone is limited to the tissue around the active tips of the needle. And again, and I like to repeat it, there's no damage at the surface, and so there's no damage at the dermoepidermical junction. And because melanocytes are exactly at the dermoepidermical junction, the risk of having some PIH is absolutely very low, because we pass over this layer and we can go deep inside the skin. This is an animation that can try to show you the so-called comfort flow way to how the needles are inserted inside the skin. And you can see that needles are inserted line by line like a wave inside the skin. This can reduce a lot the pain felt by the patients. Here we can see the 3D concept developed by Lutronic, being able to decide the depth of penetration of the needle on the same skin area. So on the same point, we can do more than one pass. We can start to hit the skin or to create small damages inside the skin in a very deep layers. Then we can do a second pass in the medial part of the dermis, and finally we can do a more superficial damage, and this way creating a multiple layers damage. Each of them are very small, but if you consider all together, we can create a great damage there, and so we can have a 3D so-called fractional tightening and with volumization of the skin. I really love these pictures. As a surgeon, I like to see what I'm doing. This is a picture courtesy of Dr. Go. It is a dermatologist in Korea. And here you can appreciate the dermal damage we can create modifying the penetration. So with 0.5 millimeter, we have a damage in the very superficial layer of the dermis, while going to 1.5, 2, or 3.5 millimeters, we can go very deep inside the skin, creating exactly where we want the damage inside the skin. on this other paper, and I consider this paper extremely important when you will start to use this device, is the histometric analysis of skin radiofrequency interaction using a fractionated microneedling delivery system. If you go deeper inside this paper, if you read this paper, you can understand that naturally increasing the energy you will have more damage, but the energy is not the most important setting. The most important setting to choose during the procedure, or better before the procedure, is the penetration of the needle and the conduction time of the energy, or the pulse duration of the energy. If you look at the graphs there, you can see that on the here you can see that the damage inside is varying a lot considering the different penetration depth, and also here if you consider the conduct time, the pulse duration, the damage is very different if you increase the pulse duration. While if you go to look the energy level here, you can see that varying the energy, the damage is not so important. So when I saw this paper for the first time, I decided, okay, to play with the energy, but I keep in mind that the two most important things to modify to obtain better results and to adjust my setting on the skin features of that particular patient is the depth of penetration of needles and the pulse duration of the energy. To be more practical, because I know that inside the audience there are some doctors that already have this device, I want to share with you my approach to the treatment. During the first consultation, I tell my patients that I always need from 3 to 5 sessions of treatment, and this depends naturally on the type of the skin problem, on the severity of the problem, and naturally on their healing capacity. I always tell them that the interval between sessions is usually 30 to 40 days because collagen needs time to be produced, and that I cannot do. I don't want to do treatments every couple of weeks because I need time to have a new collagen production. The third thing I always tell them is that the procedure is performed only under topical anesthesia, and that they can feel only some pain only on the bone prominences, and I'm more thinking about the chin. This is important thing because they don't consider this procedure as an invasive procedure, and they can accept it very well. I always tell them again that they will have a moderate swelling for maximum 1 day, and that they will have a redness for at least 1.4 days, and a prolonged up to 4 days. And naturally this depends on the settings you will apply on that patient. After the procedure, they will have to apply on the skin only a moisturizer a few times a day for the first 3-4 days. And I apply in my office on their skin only the first day an antibiotic ointment. About the results, I always tell them that they have to wait until just before the second session to start to see some benefits. And I also tell them that sometimes happens that they can have some very fine crust for 3-4 days after the redness goes away. And during the first consultation, I also consider if the patient, it is very important to exclude eventually the patients, I always consider if the patient has a severe systemic diseases. And if the patient presents severe diseases, I usually exclude them. I ask the patient if they, if he or she takes some anticoagulant drugs, and if they are taking these anticoagulant drugs, I usually exclude them, or I ask them to stop to take these drugs 3 days before the procedure till 1 day after the procedure. I receive a lot of patients in my office saying, "Doctor, but I don't heal very well. I had a lot of keloids in my life, but when they show me their skin, they don't have keloid or hypertrophic scarring." This is an idea that they have about their healing, but frequently is not correct. So I exclude the patient from the procedure only if the history of keloid or hypertrophic scarring is real, is demonstrated, and it's evident. And naturally, I exclude from the procedure patient who presents active skin infection. I don't exclude them really, I only postpone them after the healing of these diseases. Before the procedure, I apply on the skin of the patient, in this case, a treatment of the lower 1/3 of the face and of the neck. I apply an anesthetic cream composed by 7% lidocaine and 7% tetracaine for 1 hour, and then I remove it as a mask, and then I go to the procedure. I don't have fixed settings. I always, or quite always, modify the setting I apply on the patient, but I have some general and practical rules that I always apply. The first very important rule is that the thicker the skin, deeper the needle's penetration we have to apply. We cannot think to apply the same settings on the skin of an acne scar patient, maybe a young 30 years old man with acne scars that present usually a thick skin. We cannot apply the same settings on this guy and on a 70 years old lady that usually present a very thin skin. So we have to modify that considering the theoretical thickness of the skin of that patient. The second general rule I apply is that deeper the needle's penetration, higher the energy and longer the pulse duration I can apply there. So please don't use high energy with very long pulse duration time if you are using a very 0.5 millimeter penetration, for example. This can create some damage to the skin and is not correct. And the other general rule I apply is never go deeper than the skin thickness of each anatomical region. And so we must remember that, for example, the mental region has a total thickness of 2.5 millimeter, while the lids present 500 microns of penetration. So naturally, we have not to apply the same settings on different anatomical regions. The fourth general rule that I apply is that usually I apply more than one pass, usually 3, and I start with the deepest one, concluding the treatment with the more superficial. And going pass by pass, I reduce the energy and I reduce the pulse duration. So going towards the surface, I reduce the energy and I reduce the pulse duration. And the fifth thing, this is more a practical one, is not a general rule, but I always change the direction of my treatments pass by pass, and this is to obtain a more 3D tightening and volumization of the skin. And I put in this slide my idea on how to perform a treatment of the face and of the neck with the idea of doing 3 passes on the face of the patients. These are three pictures taken on the patients immediately after the procedure and after the application of the antibiotic ointment. You can appreciate on the left some pinpoint bleeding and the classical redness. If you will wait for a few minutes, you will have a swelling that will disappear in less than 24 hours, and while the redness will disappear from 1.5 to 4 to 5 days. But going to the more practical things, and because I think that pictures speak louder than words, I go to some cases. I put together some of my cases and some cases that other very kindly doctors gave me to show you today. This is one of my patients who arrived to my office with this very deep boxcar scar of naturally acne scars. I treated him for 3 times, and every time I applied the 3 passes technique, modifying the energy and modifying the depth. On the right side, you can see the results I obtained 3 months after the last procedure, and the white color you can appreciate on his right cheek is the sun protection he has to apply on his face. I ask him to apply on his face every day. Here, there's the same patients. Maybe the results here is much better. Again, I repeat, on the right side of the slide, you can appreciate the 3 months follow-up picture after 3 procedures. I perform the procedure every month, so 3 months for doing 3 procedure, and so this is 6 months after the first procedure, and you can see that the scars are absolutely better after this procedure. Another of my case, this is 4 months after the last procedure. The problem of this guy was more on temporal region and on the cheek. Again, 3 procedure, 3 passes in each procedure with an interval of 4 weeks between each procedure, and the follow-up on your right side is 4 months after the last procedure. And the same guy on the other side, this is the left 3/4 view, 4 months after the last procedure. I did 3 procedures on him, 3 passes in each one, with an interval of 4 weeks in between. Again, now a lady, not more a man. She presented with thinner skin, but also on her I did 3 passes. I reduced only the first one, not to 3.5 millimeter penetration, but to 3.0. On the right side, you can see the 4 months follow-up picture on the left 3/4 view. I did on her 3 procedure, 3 passes in each, with an interval of 4 weeks between each procedure. And this is the right side of the same patient. The skin texture is much better 4 months after the last procedure, and again I did 3 procedures with 3 passes each. This is an extremely severe case. These patients present an elastosis as well as acne scar, so I did a very aggressive procedure. She presented a very thick skin, so I did 3.5, 3.0, and 2.5 passes with a very high energy and very long pulse duration as settings. And this is the same patients. I want to focus. I focus my attention more on the cheeks of these patients, and if probably you can see she has less wrinkles on her left cheek after 3 procedure, and then 4 months after the last procedure. But I'm not the only one who are using this, and because I told you at the beginning that it can use also on dark skin or tanned patients. This is a case that is coming from India. Is a very dark skin patient. Look, is only 1 treatment with a 3 months follow-up. Now, Dr. Swapnil Shah, I don't know if I pronounced correctly his name. Anyway, he used 3 passes and he used, as me, only topical anesthesia. Look at the right 3/4 view of the same patients, and you can better appreciate how the very deep boxcar scars she presents on her right cheek are absolutely better after only 1 treatment. And the lateral view of the same patients before and after only 1 procedure, and the left 3/4 view before and after. But look, the lateral view here, it's absolutely clear how much was the improvement after only one treatment performed on her face. But again, going from east to west, we can go to Florida, US, and look at this patient. This is a fantastic case, in my opinion. Dr. Mayoral from Florida looked the patients before at the baseline. Look in, after 1 month after one procedure in the center of the slide, and 1 month after the third procedure. The improvement is unbelievable, in my opinion. But look at these patients in the right three-quarters view. Again, baseline, 1 month after one procedure and 1 month after the third procedure. Dr. Mayawar was so kind that of taking the picture of these patients also with a very long follow-up. And so look at the same patients before and 6 months after the third procedure. And this could mean that the improvement of the skin quality can go ahead for 6 months after the last procedure. And this is a very important thing to say to our patients, I think. Moving to another topic, the rejuvenation of the face. This is one of my patients. I like to combine treatments because I wanted on her, for example, to solve also this pigmentation she presented on her face. She presents on a very with a skin with a very low amount of luminosity. On the right side, you can see the 4 months follow-up. I did 3 procedures on her, 3 passes each procedure with an interval of 4 weeks between procedure. But I added a treatment with a Spectra 532 nanometers QS treatment to remove all this pigmentation on her face. And look at the same patient on the other side, the same settings as before. Look, the improvement of the skin texture, but also the improvement of this pigmentation treated by the QS Spectra 532 nanometers wavelength. This is much more interesting case. I think that these men deserved a facelift, but she didn't want to hear the term surgery, so I tried the procedure on him, and I did 3 procedures. And look the improvement of the skin laxity along the jawline on the right side, and the improvement also of the wrinkles. Here maybe is much more clear where the improvement was. And if we look at him on the right side, I removed the big lentigo on the right temple with the QX Spectra, but I treated the full face with the microneedling radiofrequency, and look where we obtained a great improvement of deep wrinkles and on skin laxity, again along the jawline on his face. Another patient that I treated recently, we did a blepharoplasty on her, I think a couple of years ago, and look on the improvement of the jawline and the deep wrinkles she presented on the right cheek before the procedure. Again, I did 3 procedures with an interval of 4 weeks between procedures. And the same patient on the other side, please don't look at the eyes. We did surgery on her, but look at the cheek. We had a great improvement of deep wrinkles and also a great improvement of the skin laxity again along the jawline. And here, another old man, same condition. So skin laxity on the face. We treated him with the microneedling radiofrequency Infini and with the Spectra 532. Look the improvement of the along the jawline 3 months after the last procedure, and also the same man on the other side. Look the deep wrinkles and the skin laxity on the left, and how the skin laxity is improved after the procedure on the right side of the slide. Here we have a picture that Dr. Stephen Weiner gave me, Stephen Weiner from Florida, US. Look how the deep wrinkles of the forehead improved after the procedure. But I think that this is a fantastic case again from Stephen from Florida. Look how on this lady, the very, very deep wrinkles improved after 2 treatments performed at 1 month interval. He had different idea than mine. He is doing 3 passes, and he used topical lidocaine, but also nerve blocks to reduce the pain that the patient can feel during the procedure. Looking at the same patients from the lateral sides, the improvement is absolutely unbelievable. I repeat, he did 2 treatments at 1 month interval on her face, doing 5 passes under nerve blocks or topical lidocaine on her face, but the result is absolutely amazing. And look the close-up of the same patients. Look how the very deep wrinkles improved, and also the skin laxity improved a lot after the only 2 treatments. But where probably the device is obtaining a very, very good results is the neck laxity, or the laxity of the skin of the neck, where sometimes we can obtain extremely good results. This is one of my patients, and I try to standardize the results and the way on how to show you the improvement these patients presented after the procedure. So using my PowerPoint, I put a white line running from the lateral canthus of the pre-op picture to the lateral canthus of the post-op picture to demonstrate that these 2 pictures are exactly at the same level, and then putting a red line on the left side before the treatments and the green line on the right side after the treatment, and trying to compare them, we can have a very good idea on how she improved after the procedure. Naturally, we can do the same thing on another patients. Look at these patients again. So white line running from the 2 lateral canthus before and after, and again a red line before and a green line after the procedure. We can merge them, and so we can have an idea on the improvement she presented after the procedure. Sometimes, as I told you before, this improvement is absolutely unbelievable. Another of my patients, 3 months after the last procedure, white line again to demonstrate to you that these 2 pictures are exactly at the same level, and the red line is before, the green line is after. We can try to put these 2 colored lines together and to try to demonstrate the improvement of the laxity of the skin of the neck of these patients. And I also think that here the result is absolutely very good. Another patients before and after, and as I did before, there's the white line running through the 2 lateral canthus of the patient before and after. Red line is before, green line is after, and we can put these 2 lines together to try to demonstrate to you again the improvement she had after 3 procedures. The picture on the right side is at the 3 months follow-up, and the interval between procedure was 4 weeks. Again, another patient before and after, again 3 months, white line, red and green. We can try to put this red and green together to try to demonstrate the improvement she had. And so red and green, and we can so in a very clear way demonstrate the improvement she had on her neck. But because again I'm not the only one, again a very nice picture from Stephen from Florida. at the baseline, and 6 weeks after only one treatment on the right side. He did 4 or 5 passes in different anatomical region of the face, and did that only under topical anesthesia. But look at the same patients after 2 treatments at 1.5 months interval with 4 passes and topical anesthesia, and please look the lateral side of the face of these patients and how she improved only after 2 treatments with the Infini microneedling radiofrequency. Again, another patient from Steven from Florida. Look the skin under the chin before and after the procedure. Only 1 treatment under topical anesthesia, 3 passes on her face, and 2 months follow-up on the right side of your slide. And look at the same patient in the 3/4 view, 2 months post-treatment, again 3 passes only under topical anesthesia and only 1 treatment procedure. And another patient, I think this is the last one, 4 passes on the face of this lady, 1.5 months after 1 treatment in the frontal view. Look how the deep wrinkles on her cheeks improved after the procedure. Look at 3/4 view. The improvement of deep wrinkles are absolutely more clear in this 3/4 view of her face, only 1.5 and only after 1 treatment. So I concluded my talk, and now I'm absolutely available for, I suppose, a lot of questions will come from my audience. Richard? I'm waiting for...
Thank you, Dr. Clementoni. Yes, thank you, Dr. Clementoni, for an excellent presentation and sharing your experience with Infini. We would now like to open the webinar up to questions from attendees. If you haven't already done so, please submit your questions by typing into the comments box located in the control panel. I would like to begin with a couple questions. First, Dr. Clementoni, in your experience, what percentage of patients do you feel are satisfied with the treatments they received?
With the right indication, and if you do a very good first consultation, and so excluding the patient with unrealistic expectations, I think that more than 90% of them can be absolutely happy about the results.
And when the patient comes in during the summer months, what
Yes.
would you recommend? Can you use the Infini during the summer, and what would you advise?
There are many very funny stories about that. Last year, and as well as this year, I had a lot of patients that started to go to the sea in May, and they came to Milan on Monday. They did the procedure. They stayed in Milan for a couple of days to do something, and then they go back to the sea on Thursday, and they continue to do that for all summer. So I am absolutely not worried about tanned patients. I repeat what I told at the beginning. We are passing over the dermoepidermical junction where melanocytes are, and you know that we are not creating a damage there. So the inflammation at the dermoepidermical junction will not be present. And you know that the inflammation will determine the arachidonic acid, and the oxidation of the arachidonic acid can affect directly melanocytes. But if you are performing a damage depth inside the skin, we are not affecting melanocytes, and the risk of untanned patients is absolutely extremely low.
In your experience, is this treatment less painful than other tightening procedures like Ulthera or other methods?
I tried on myself both. I tried Ulthera on my forehead, and I tried this procedure on my face, because I want to try every time I have a new technology in my hand. I want to try on myself. because I want to say to my patient exactly what they can feel. And with the topical anesthesia, the Infini is not painful. You can feel something on the bone prominences, means the forehead something, the chin something, but is absolutely acceptable, while the Ultera I tried on my forehead was really painful. So I think that if you want to do an aggressive procedure with Ultera, you need some nerve blocks, or better, my patient will not accept this kind of procedure without nerve blocks.
And we've had some questions about some specific settings. Are you able to share with us some of your settings that you use?
Yeah, I started 15 months ago with a low amount of energy and a very short pulse duration, and procedure by procedure I moved to higher energy and longer pulse duration. Now, for example, on an acne scalp patient, I start with a 3.5 millimeter penetration. I use energy 11, 12, and I start with 360 milliseconds. Then I change the penetration depth to 2.5 millimeter. I decrease the energy to 9, and I decrease the pulse duration to 260, 280, and finally I do a third pass with 1.5, sometimes 1, and I reduce the energy to 6, 7 with a pulse duration of 140, 180, depending on the thickness of the skin of the patient, and this is my third pass. I know that these settings can be considered extremely aggressive, and I don't suggest to start with them at the beginning. Please make your own experience. Start with lower energy and short pulse duration, and then looking at what will happen on the skin of your patient, increase energy and pulse duration. But a very small and quick suggestion: don't modify energy and pulse duration at the same times. If you want to really understand what increasing the energy means and what increasing the pulse duration means, don't change them simultaneously. Please maintain fixed the energy and increase the pulse duration, and look if you will appreciate something better. And the next time, maintain fixed your pulse duration and increase the energy. Only modifying one variable and not both, you can really understand what will happen on the skin of the patients.
Do you use any particular serums for post-treatment after the patient, for the patient?
No, to be honest, no. I apply, as I told you during the talk, only an antibiotic ointment and nothing else. But this is true. A lot of my patients use everyday vitamin A creams at home during the night because we know that retinoic acid determines collagen production. But this is a at-home procedure. So I tell them, please, if you are using retinoic acid or retinol, don't use it for 1 week after the procedure. You can continue to use it, but only 1 week after the procedure.
What settings do you use when you treat around the eyes?
I didn't. Means being a surgeon, I do usually only surgery on the upper eyelid, so I don't do any different procedures there. While on the lower eyelids, considering the thickness of the skin there, I prefer to use a fractional CO2 to obtain a very good result. So this is not one of my indication. I think that that anatomical region, and I'm speaking about the lower eyelid, I think that they're the gold standard for the rejuvenation as the fractional CO2.
Have you had any issues where people have had sensitive nerve responses after treatment?
At the beginning, as always happened, I was thinking that this could be considered, that this technology could be considered as the non-surgical facelift technology, and this is not true. We cannot promise our patients we can obtain a result as the surgery can do, but it works very well. So we have not to expect too much, and we have not to push on our patients what they can have. We know also that there are some patients that have not a vigorous healing capacity, and they have not a great capability to rebuild the skin. So we cannot always have the same results. I prefer to treat younger patient than older, and this makes sense in my opinion. The capability to create new collagen in young patients is much higher, but please don't push, mostly at the beginning, don't push too much on the results you can obtain, and you will have extremely happy patients.
How long does a typical session take to do a treatment on a patient?
It depends on the area you have to treat. Considering full face and neck is 25 minutes, 25 to 30 minutes. Is on the 1 hour incubation of the cream absolutely longer, much longer usually than the procedure is.
When you use your aggressive settings, have you found that the topical anesthetic is sufficient, or did you need to do something more? I usually use only topical anesthesia. Sometimes on very particular patients who ask me, "Oh, doctor, I don't want to feel anything," I use nerve blocks, but it's extremely rare. There are some tips and tricks to use during the procedure. So, for example, if you stretch the skin, if you have to treat the jawline, and if you do that with the handpiece, the needle is going towards the bone, and this is why the patient can feel some pain. But if you stretch the skin from the cheek upward, moving that line upwards, and then you can do the treatment, the pain of the patient is absolutely much less. So applying these very practical tip and tricks, and on soft tissue, the pain is minimal. Also, if you are using 3.5 millimeter penetration, it's not so important. So there are 3 important areas for the pain. One is forehead, but on the forehead I don't use very deep needles usually. The zygomatic arch or the zygomatic area and the chin. But these areas are very small, so you can cover them with 3 shots on the right side, 3 shots on the left side, the zygomatic area, and with 6 shots, 12 better. With 12 shots, you can cover the chin. So none of my patients told me, "Doctor, I have to suspend the treatment because of the pain." I did the treatments usually without problems. Have you used the procedure for off-face treatments like hands or arms?
I didn't, but I know that there are many doctors around the world, and maybe next time we can share with you some of their results. I know that there are many doctors around the world doing this kind of procedure, or better, applying the Infini technology on these indications, and they are saying me that they are obtaining very good results. I am more focused, because of my origin, more on face treatments, but I know that other doctors, I already told you, are extremely happy about the results they can obtain on arms and legs.
Would you be able to share with us, I know this is very question that depends very much on the area and the circumstances, but What's the range of charge that you can have per session, or do you offer this as a package of treatments for patients?
Oh, do you want to know my secrets? It's okay. No, I'm considered here as an extremely expensive doctor, but because I offer this technology as one of the first here in Milan, I'm now charging a lot my patients. The range of the charge of my patient is going from 400 to 700 euros for each session, and this means around from $600 to $1,000 or $900 for each procedure. So to do full face and neck treatments, 3 procedures in my office is 2,100. Really, I offer sometimes to my patients a pack. So if they accept to do the procedure, all of this procedure, I don't charge them 700 euros each time, but I reduce the total amount of some hundreds euros. So not 2,100, but 1,800 euros for the total procedure.
Okay, I think we have time, really run out of time for questions, and so I would like to conclude today's seminar, and would like to thank you, Dr. Clementoni, for your excellent presentation and sharing of your experience with Infini this evening. It has shed some light on a new dimension of anti-aging treatments, and I'd also like to thank everyone for attending this evening's session. If you would like to leave feedback on tonight's event, or would like more information on Infini, just leave a message in the comments section and we will promptly reply. We also have prepared a survey at the end of the seminar, and when you log off, the questionnaire will pop up automatically. If you would like to watch this or any other Lutronic webinar, just go to the website link at www.lutronic.com/webinars, or go to www.lutronic.com and look in the News and Events section. That concludes today's presentation. Thank you very much, Dr. Clementoni.
Thank you to you, and thank you everybody. If you have questions, please write to Lutronic your question by email, or write me an email directly, and if I will be able to do that, I will answer you as soon as I can. And before concluding, I want to thank everybody who helped me to prepare this webinar, Richard and Meili and all other Korean people who helped me a lot to prepare this. Thank you very much, and goodbye everybody.